Hello everyone. So in this video we are going to discuss about the amyloidosis, like where it get deposited and in which organ it is get deposited and when it will deposited and how we can diagnose it. So in this we have to study like when, where and how we can diagnose it. So these things we have to discuss about the amyloidosis. So first of all we have to know the definition of amyloidosis. So for the definition of amyloidosis, so amyloid, it is a protein. So it is a protein. But is it a normal protein? No, it is a misfolded protein. So please remember that it is misfolded protein. And when it is misfolded protein, so it is extracellular, means outside the cell this protein gets misfolded. So it is extracellular misfolded protein. So this is the definition of amyloid, that it is a protein but that protein is misfolded and it is extracellular. So this is the definition of amyloid. Now what were the examples, like where, when it will deposited. Now let's start that when it will deposited. So these were the diseases and what type of amyloid is deposited in these diseases. So the first one, that is the chronic inflammation and cancers. So in all these we have to know that amyloid is deposited. So A represents for the amyloid. So in all these A represents the amyloid. Now in the chronic inflammation or in cancers we have to remember like cancers, like example renal cell carcinoma or Hodgkin lymphoma. And in the chronic inflammation, except one condition in the chronic inflammation, that is the chronic bronchitis. Except in chronic condition, that is except one condition, that one is chronic bronchitis. In this condition the amyloid is not going to deposit, but in all other chronic inflammation, whenever inflammation is going to occur more than 3 months or it occurs quite a long time, then it is known as chronic inflammation, and in all those conditions amyloid get deposited. Now we have to learn like which form of amyloid is going to deposit. So for that we have to learn that in the chronic inflammation and in the cancers, the AA type of the amyloid gets deposited. AA type means amyloid associated gets deposited. So in both these conditions we have AA type. Now in the familial Mediterranean fever, so in the familial Mediterranean fever also, like it is also a fever, so in this also like AA type of amyloid get deposited. Now the other one, that is medullary carcinoma thyroid. So in medullary carcinoma of thyroid we have to remember that in medulla we have calcitonin hormone. So here A is for amyloid and for the calcitonin we have to write here cal, that is A cal. So A cal means amyloid calcitonin get deposited. So this is the form of amyloid which get deposited in the medullary carcinoma of thyroid. In this way we can easily remember it. Now now another one, that is systemic senile amyloidosis. So in systemic senile amyloidosis, it means that it is very senile, means aged person. It is going to occur in the aged person. So for this also, and for the familial amyloidotic polyneuropathy, in this also we have ATTR type. But in one we have increased ATTR and in other one we have mutant ATTR. So please remember, for the neurons, in neurons there is mutation can occur. So in neurons mutation can occur. That's why ATTR, in this we have mutant ATTR. While for the systemic senile amyloidosis, as the age is increasing, so we have increased ATTR in the systemic senile amyloidosis. So I hope these two were, you can remember it now. Now in the Alzheimer disease, which form of amyloid is deposited? So one is A beta and another one is A beta 2. So as for kidney hemodialysis is going to occur in kidney, and we all have two kidneys. So we all have two kidneys, that's why here beta 2 is there. While for the Alzheimer disease, we all have only one brain. We all have only how many brains? Only one brain. That's why A beta is single one. So A for amyloid and beta. So A beta deposited in Alzheimer disease, A beta 2 is deposited in hemodialysis condition. While for the multiple myeloma, we have amyloid, A for amyloid, and in multiple myeloma, as we all know, light chain is deposited. So for the light chain, we have Al. So in multiple myeloma, Al is deposited. So this is all the disease in which amyloid is deposited. Let's revise once again. So for the multiple myeloma, in multiple myeloma, light chain is deposited. That's why Al is deposited in multiple myeloma. In hemodialysis, we all have two kidneys. That's why 2 is there. So for kidneys, we have two kidneys. A beta 2 type is deposited. While for the Alzheimer disease, we all have one brain. That's why A beta is deposited. That is single. Please remember, we always used to confuse between hemodialysis and the Alzheimer disease, that in which one we have A beta 2 type and in which one we have A beta type. So from now onwards, we have to remember, for the hemodialysis means we have to do dialysis, and for dialysis we have kidneys. So we all have two kidneys. That's why A beta 2 is in the hemodialysis. Now in the Alzheimer disease, we have A beta. Now for the familial amyloidotic polyneuropathy means in neurons there can be mutation happen. That's why it is mutant. That's why it is mutant amyloid TTR. While in the systemic senile amyloidosis, the age increases. That's why increase ATTR. Please remember, increase ATTR. For the medullary carcinoma thyroid means medullary, in medulla we have calcitonin. So that's why ACAL. That's why ACAL. Cal for calcitonin. ACAL type amyloid deposited. Well, for the chronic inflammation, for the cancers, or for the familial Mediterranean fever, we have only AA type deposition. So these were the types of amyloid which get deposited in disease. Now we already covered this when topic. Now we have where it is deposited. Now the other table is for where it is deposited. So this is the table like where the amyloid is deposited. So for the kidney, in kidney, the most common place where it is deposited is, so kidney is the most common organ where the amyloid gets deposited, and mostly in the nephrotic syndrome, and where it is going to deposit it, the location in the kidney is mesangium. Please remember, it is mesangium. So it is the mesangium. Please remember this. Please remember this, and it is deposited in the kidney. In kidney, where it is deposited, the location is mesangium. While for the heart, the position is subendocardial and under the endocardial cushion. It get deposited. Who get deposited? Amyloid get deposited. Where in the heart it get deposited? It get deposited under the subendocardial. It get deposited under the subendocardial. And in heart, which disease it occurs when the deposition of amyloid is there? That is RCM. And it is seen in most common in the old age. Most commonly seen in old age. While for the liver, in liver, for where it is deposited in the liver, we have to remember that in the space of decay, it get deposited. So in the liver space of decay, the amyloids get deposited. While for the spleen red pulp and spleen white pulp, as we all know, white is the sabudana. For sabudana, we always used to remember that white is sabudana, and in English sabudana is sago spleen. So sago spleen. While for the red pulp, red means lal, that is lardaceous spleen. That is lardaceous spleen. We easily remember it, lardaceous, red or lal, or that's why. Now please don't confuse between white is sago means sabudana, and red is lardaceous spleen. While in the skin, where it get deposited, when it get deposited in the skin, it looks like pinch purpura. So it presents like the pinch purpura. While in the GIT, when it gets deposited, that particular organ becomes enlarged. Please remember, when in the GIT it deposited, that organ become enlarged. So we can see organomegaly. While for the joints, as it is deposited in the joints like in the wrist joint or in the knee joints, so for example like wrist or knee joints, it get deposited, and when in the wrist or knee it get deposited, we have a carpal tunnel syndrome in which a beta 2 it's deposited. While for the blood vessels, it get deposited under the subendothelial cells. So these are the points where it is deposited. Please let's revise and remember it again. In the blood vessels, subendothelial. In the joints, carpal tunnel syndrome will develop. In the GIT, whichever organ it is deposited, organomegaly will be there. In the skin, pinch purpura will be there. For white, sagospleen. For red, lardaceous lal spleen is there. For the liver, space of DSEP position is there, place is there where amyloid is deposited. In the hearts, under the subendocardium, that's why subendocardium deposition will be there. In the kidney, mesangium. In the mesangium, amyloid get deposited. Now related, as I already told that whenever in the GIT it shows organomegaly, while for there we have one exception, that is the kidney. So all organs increase in size. As I already told you, whenever there is deposition of amyloid, all organs shows increase in their particular size. But we have one exception, and that exception is the kidney. And in starting there is also increase in size in the kidney, but in the late amyloidosis but in the late amyloidosis we seen the shrinkage is there. And why this shrinkage will be there? Due to ischemia we see shrinkage. So all organs increase in size except the kidney, and in kidney particularly in the late amyloidosis situation. So this is the one note point we have to remember, that which organs shrink in size in the deposition of amyloid. The answer is kidney. Now the another table, that is for the diagnosis, like how we can diagnose it. So for the gross stain, how we can diagnose? So the stain which is that is the gross stain, and what is the detection point? And for that we have Lugol's iodine. For the gross stain, we have Lugol's iodine. Please see it here, that this is the gross stain. We can easily see a waxy kidney. We can easily see here, and it is the gross specimen of the kidney, means there is deposition of amyloid is there. And on the gross stain, which stain is there? It is Lugol's iodine stain. On the Lugol's iodine stain, we can easily see the color of the kidney will be mahogany brown. The color of the kidney is mahogany brown color. And what other conditions which shows mahogany brown color? So for the mahogany brown color, we have two conditions. First one is the amyloid. First one comes under the amyloid. In the Lugol's iodine, we see the Lugol's iodine, we see mahogany brown color, while the other condition is the oncocytoma. In which we see the same in the kidneys. So these two conditions we found in the mahogany brown color. So now this is the gross specimen. Now the next point of the table is the microscopic stain. So in the microscopic stain, like the Congo red stain, so these all were the microscopic stain, like Congo red, thioflavin T, methylene violet, crystal violet, or the PAS stain. All this comes under the microscopic stain. So when we see in the Congo red, we usually see the apple green birefringence. I will show you image in a few minutes. So please remember, in Congo red we see apple green birefringence on polarizing microscopy. So On the Congo red, we see apple green birefringence on the polarizing microscopy. Now let's see this image. So this is the image of that particular stain. So in this we see a Congo red stain. We see Congo red stain, and in Congo red stain under the polarizing light. So please see it very carefully. This is under the polarizing light. We see a apple green birefringence color, apple or apple color, green color birefringence. So please remember, apple green birefringence is seen on the polarizing microscopy. And this one, as we see a slight pink color is there. So that one is the salmon pink color. That one is salmon pink color, and it is seen on the light microscopy. So this one is on the light microscopy, and this one is on the polarizing light. So the another point of that table. So let's on the Congo red we see apple green birefringence on which light? On polarizing light. Please remember it very carefully. Now the another one, that one is the thioflavin T. So please remember here T is very important. Why T is important? So T, as in the light also T letter is coming. As in the light also T letter is coming. So please remember it is ultraviolet light. Under the ultraviolet light we use the stain thioflavin T. Now another one, that is the methyl violet, or we can say crystal violet color. So it is seen under the stain metachromatic stain. So it is seen under the metachromatic stain. And how it's look like metachromatic stain? So this one is the metachromatic stain. So this one is the metachromatic stain, and on metachromatic stain we see which color? We see a methyl violet or crystal violet color. Methyl violet or crystal violet color. Please remember under the metachromatic stain. Now again move to the table. So in the metachromatic stain, methyl violet or crystal violet color will be seen. Now in the electron microscopy, please remember it's like so many times this question already asked in the exams. So we have to more careful about this question, that under the electron microscopy how the amyloids is looking like. So first we will write and then we will see by image. So we see non-branching fibrils. We see non-branching fibrils, and the length was 7.5 to 10 nanometer. Please remember length is 7.5 to 10 nanometer, and we see non-branching fibrils. And in the X-ray crystallography we see beta plated X-ray crystallography. Like X is a letter A B C D. So X is a letter. Here beta is also letter. So beta plated structure. Or sometimes it asks that beta plated sheets is seen under X-ray, electron microscopy, or polarizing light. So please remember X-ray, because beta B is a letter, A B C D letter. So X is also a word from the A B C D. So that's why how we can remember it by this mnemonic, that X-ray or beta plated sheet. So X-ray, beta plated sheets. Now we will see both the images of electron and X-ray electron crystallography. So here this one is the electron microscopy. Anything in pathology which is seen like black and white, that is under the electron microscopy. So this one is image of electron microscopy, and in this image what we can see, we easily see some strands were there, and those strands were like straight. Those were straight, means they have indefinite length. They have indefinite length, and there is no branching in them. As we can see there is no branching is in there. There is no branching. They are just straight line. So under the electron microscope what we are seeing? We are seeing non-branching fibrils, and these fibrils have indefinite length. And what is the diameter? It is 7.5 to 10 nanometer. Please remember it is 7.5 to 10 nanometer. Now there is one more question, that now which sample should we take for checking of amyloidosis? So now the investigation of choice for the sample, the investigation of choice will be abdominal fat aspiration. Abdominal fat aspiration as it is more common than the rectal biopsy. It is more common than the rectal biopsy. So if it asked in the exam, so we have to mark the answer investigation, that is the abdominal fat aspiration as compared to rectal biopsy. And now one more question, that what is the new technique? So the new technique is scintigraphy. New technique is scintigraphy. Scintigraphy, in which we see the extent of the amyloidosis. We see the extent of amyloidosis. Now that's all what I want to tell you. Now I have some questions. So I think you have to uh, comment in the comment section that what is their answer. So we have to find the incorrect match with regarding to the amyloid. Like the option first is the chronic inflammation. Like in the chronic inflammation we have AA type. In the familial Mediterranean fever we have type AA. In the familial amyloidotic polyneuropathy we have ATTR type. And in the Alzheimer's disease we have type, that is A beta 2. So we have to find the incorrect match. So please comment in the section what is the answer of this question. So that's all for amyloid. I hope this video is very useful to you. Thank you. Bye bye guys.